Hi, it's Dr. Felicia, and this is a PSA for Mental Health Awareness Month. Today, I'd like to share with you some tips, or rather, behavioral indicators that your mental health might need some attending to. So, the primary things we look at would be sleeping behavior. So, if you are having greater difficulty falling asleep, staying asleep, or sleeping waking up earlier than you like to. If you find yourself sleeping longer than normal, like you just don't want to get out the bed consistently, and if you find that you're having difficulty sleeping at all, these are some indicators that your mental health might need some attending to, as well as if your eating behaviors change. So you're eating a lot more or a lot less than you normally would. That can be an indicator if you've lost a significant amount of weight. So let's say more than 10 pounds or 10 pounds or more in the last 3 months. That's something you might want to be aware of. If you're doing that without effort, of course, if you are exercising and changing your diet and you're losing 10 pounds or more, then that's not the case, right? This is more about if you are unintentionally losing weight without effort. That's what we are talking about here. If you're isolating or withdrawing and avoiding people more, so you normally would be hanging out with your friends or family, and now that when you get those invitations, you're not going, or you say that you'll go, but you don't go. So those are indicators as well. And if you find yourself to be more irritable, you are lashing out, or find that you don't want to hang out with people because of fear that you will lash out. If you find yourself more anxious, depressed, these are some of those, these behaviors are indicators of some of these things. If you're on edge most of the time, feeling hopeless, helpless, as if the worst will happen. So those are feelings, more emotional states, but definitely your behaviors are things you want to pay attention to. If you're having more memory problems, cognitive issues, problems with attending or tension, you are having problems concentrating, remembering things, then that would also be things that you want to attend to regarding your mental health. So mental health doesn't always look the same in each person, as we've talked about, and you've seen, I'm sure, all over social media or other places, that people can be depressed and not look depressed, right? Because we are all good at wearing masks. So you might ask someone how they are doing, and they'll say, oh, I'm fine. But inside, they are not feeling fine, because we've learned as a society to mask how we feel to get through the day. So there are plenty of things that we want to do, not just look at what people say to us or what they, how they respond, but also if we're noticing that their behaviors are significantly different than what they might have done previously, when their behaviors indicated that things were fine for them, not just because they said they were okay, but actually their behaviors were in line with what they were saying, right? But in terms of just, improving these things, is really about doing what works. So changing the way we think, being physically active, getting enough sleep, talking to someone if we need to. So whether that is a trusted friend or advisor, whether that is a faith-based advisor, or even a mental health professional, knowing that it's okay to not be okay, but it's not okay to stay there, okay? So get whatever help you need that is helpful, right? Not turning to substances or things like that to further mask how you are feeling, but actually doing something that's going to help you get out of that rut and feel better. That is the goal. That is the turning point that will help change things for you. So hopefully this information is useful, not just for you, but for others that you know and you can share it with. And know that, right, your mental health is a priority. If you don't have mental health, you don't have any health. And that, remember, mental health is a vibe all by itself. Take care.